All right, for more on this, let's now speak to South African Medical Association Chairperson, Dr. Mvuyisi Mzukwa. Dr. Mzukwa, a very good afternoon to you, and thank you so much for your time. So last year in 2024, we saw how around 800 doctors who had qualified the year before struggled to find a job in the public sector since qualifying. Then we got to understand it was driven by budget cuts for one. I mean, this year the number is around 150, at least in the Eastern Cape alone, where that report was filmed. What is your reaction then as SAMA, especially given that there is a serious shortage of doctors in this country?
Good afternoon to you, Nati, and to your viewers, and thanks for inviting me to your beautiful show. Now, we are facing a crisis as a country. We are now having over 1,800 junior doctors who are currently unemployed, nationwide. And this is despite them completing their community service. And like you said, the Eastern Cape, as you know, had recent decisions, that really that is disheartening. I mean, they issued a circular, I think that's Circular 31 of 2024, where they were saying that they are not going to be able to absorb those community service doctors who have completed community service. I mean, we know that this is a province that has serious challenges in terms of human resource. Not only the fact that it is a rural province, but also the fact that professionals have started leaving the province after many of these circulars that were issued out by the Department of Health. So, but that is a microcosm, that represents what is happening in the country. In Grooterschuur alone, I think in 2022, there was a drop of interns that were absorbed in that hospital. From a huge number going down to what we have now, very, very, very small numbers. I think it was 120 to 34 now interns that were absorbed in that hospital. Not only that, but also Mpumalanga, KwaZulu-Natal, all the provinces are struggling. You can imagine, that South Africa is having a serious problem when it comes to the number of doctors per population. We're sitting at 0.3 per thousand, way less than what is recommended by the World Health Organization. And also it points to the fact that we are still going to struggle in terms of managing our litigation. Because if you have that shortages, on the ground, those shortages on the ground, you are going to have people who are going to be have burnout as healthcare professionals, but who are going to impact negatively on service delivery on the ground, and that is going to escalate.
And I want to speak about those. I want to speak about those, factors that will be further exacerbated with this situation. I mean, earlier we spoke to the Health Minister, Dr. Aaron Motsoaledi, and he is of the view that doctors are aware that one cannot simply be absorbed into the system once they've qualified. He says, of course, outside of the challenges that you've just also mentioned, one has to apply for this kind of position. I mean, what has been your view of government's attitude in regards to this matter?
Well, as we can see now, we see a government that is unable to plan. You will notice that we've been sending students to Cuba, sending students to Russia, and all these things. But what has become obvious is that this government cannot plan. And if you ask me, this is a government that is not caring for its population, but also for its youth. How do you allow 1,800 doctors to be unemployed in a country where there's a shortage, in a country where there's poor service delivery, because of the shortages that we see on the ground? Because this does not only affect doctors, it affects other healthcare professionals as well. And you can imagine what is going to be happening. These doctors are going to go away, go to other countries, be taken by Canada, by New Zealand, by UK, by all these other countries. And it means this government is using taxpayers' money, in fact, wasting taxpayers' money to train for other countries instead of training for their own country. We see the wastage that we see. And this is the kind of attitude that we see from the minister. You know, a minister that cannot listen, you know, to what the youth is saying. The young doctors, highly skilled, highly educated. You cannot allow that skill to be washed down the drain without absorbing them to the system.
Yeah, I mean, I want to go back to a point that you made earlier. To what is the extent really of young professionals opting to leave this country in this sector, and how concerned are you about what it then potentially means for the sector in terms of providing good quality healthcare for South Africans?
We are very worried and deeply concerned as the South African Medical Association because, one, we understand that there's a dire shortage of healthcare professionals, especially doctors. Earlier on, giving you statistics, but also we know that, you know, the doctor population is aging, you know, and you would expect that the department would have a younger layer coming in, you know, especially with these shortages. But that's not the case. What we see is after community service, these doctors are not absorbed in the system. But what they do, then they leave, either they change their career to other countries, or they remain unemployed, you know. So this is going to be a serious problem in terms of the healthcare outcomes in the country, and it's going to escalate the problem of litigation that we see as like the Eastern Cape and also KwaZulu-Natal and Gauteng. So those are difficulties that this healthcare system is going to face if we still have the leadership that we're still having that has got this negative attitude toward healthcare professionals.
And one wonders what it means then for the ones that are looking at this and are still within the system and trying to finish their qualifications. They're probably worried that this is going to have a ripple effect even when they come back into the system to say, we've qualified.
It's actually demoralizing if you look at it, because you can't be a student and be, you know, having that morale to push your studies. If you can actually see that your colleagues are sitting at home and government is just looking at them and giving them petty excuses, you know, instead of creating opportunities for the young ones. I mean, this country, we know, has a serious problems of unemployment, you know, but we have employment, we've got vacancies in the public sector. But what you have seen is that there's been mismanagement of funds, there's been corruption, there's been all these things that has impacted negatively on the numbers of healthcare professionals that we see in the country. And that's a problem that is going to be perpetuated, especially if we don't rectify the problem that we're having.
Dr. Mzukwa, thank you so much for your time and your comment on this. I really appreciate it. South African Medical Association Chairperson, Dr. Mvuyisi Mzukwa, there for us.